I have two hats in this issue. I'm a taxpayer and I'm a doctor. And first of all, I'm horrified as a taxpayer to think that we may actually see the nationalization of American health care. I think that you ought to be able to get insurance from anywhere in the country, and if you did, there would be more competition rather than just a few plans. It really scares me that somebody like President Obama, who has stood up and made such ignorant and egregiously ridiculous remarks about American medicine, because he's the one who's going to revamp American healthcare. It just scares me that that's who's leading the charge. You probably all know that he suggested that doctors were going to get $50,000 to take off a diabetic's leg, when in fact it's about $750. The only thing I agreed with is he pointed out that the primary care doctors get paid peanuts for trying to prevent the need for the amputation. That is true. And then the thing that really bothered me even more was the suggestion that greedy doctors are going to take somebody's tonsils out because they'd rather make more money than leave them in. And I just find it hair-raising to think that the people who want to remake American medicine, this is what they think.
I'm the town foot cutter and tonsillectomy guy. That's my Ferrari.
The surveys show that 82% of Americans today are happy with the delivery system that they have. So I ask the question, why do we want to change it for the remaining 18%?
We're expected to bring people together with differing views, put our heads together, brainstorm, have a quality improvement project, and come up with the answer that is the best answer given all of the resources that we have. My question is, why aren't our legislators expected to collaborate, bring all of those bright minds together, and come up with the solution? I think that transparency, collaboration, and knowledgeable people sitting together, thinking through all the complexities of the system, will come up with the best answer, not someone sitting in Washington who is more concerned about their individual interests.
This is an easy one for me because I've never been a member of the AMA. In my 30 years of practice,
the AMA gets the rights to publish all the CPT codes, which we use for submitting bills to private and public insurance companies. And so that's a very big moneymaker for the AMA itself. So there's a couple of reasons why they gave their endorsement.
The percentage of physicians actually in the AMA is about 17%. So there's 17%. 1/7.
Can you elaborate or answer the specific question? Name a few things that the AMA has done to lower healthcare costs for citizens, and it was qualified by legal citizens.
Nothing.
No less than the CBO said this, and that is, and the Congressional Budget Office said the same thing. There is no way to quantify defensive medicine. Without good tort reform, you're always going to have that defensive medicine. You're always going to have defensive medicine, and that's going to be a huge cost.
one of the main reasons that there isn't tort reform is who are the politicians? And who is Obama? They are all lawyers.
Really helpful in this whole discussion is, as you look at each one of these pieces, you have to ask, is this going to help increase the supply of doctors and hospitals and providers of care, which will put downward pressure on the prices of medicine and the delivery of care, which will then make the financing mechanisms less expensive, which will then increase the access to the financing methods and make it more affordable and available to all of us.
The question was, if I'm hearing it right, as physicians, correct?
Yes.
As a physician, I don't care. I'm not an instrument of social policy. And I would caution you that if you want us to be, you're really going down a dangerous slope. Very slippery. Because to you, the issue today is immigration. Maybe later it's you're fat. Or you let your kids get fat, you're a bad mom. Or, you know, you're stupid. Or you're bald. You're saying you're bald, you're in. You should not let your medical professionals become an instrument of social policy. Although personally, my opinion on this differs very dramatically from my professional one. The question was, what do I feel about illegal aliens who are in my operating room that have no money to pay for healthcare and we're all paying for it? I feel no differently about them than I do if you're the former CFO of Ford who's in my operating room getting care. And I hope you all understand why that's a good thing.
First is a commentary that if you walk into any emergency room or hospital, you'll see prominently displayed at eye level, bright white paper, black bold ink, that access will not be denied, regardless of whether you have the means to pay or not. Everyone in our country has access to care. What we're talking about is access to a financing mechanism. That's really what's at heart here. And do we extend to these individuals a means of financing their health care? That's really what's at stake. It does have an impact on the cost. It's a simple, again, supply and demand.
One of the things I find sort of disingenuous about this topic is if you're going to talk about 47 million people, you need to then break it down into this, because this is what people are concerned about. We're not talking about this sort of the elephant in the room, and that is immigration reform. You've got to have immigration reform if you're going to have healthcare reform. About that later, but what really matters is if you look at the industries where people actually have to pay for the service, what's happened to those industries? So, cosmetic surgery, it's gotten better. It's all entrepreneurial, it's all cash. Has it gotten more expensive? No, actually, John will tell you this is impossible. The demand's gone up and the price has gone down. It's an anomaly. If you look at plans that are centered around health savings accounts, where people have some skin in the game, all those people spend money very differently than the people who don't have skin in the game. If you look at LASIK surgery, it started as radiokeratotomy and it wasn't a great operation. It became LASIK. It's become even better. The procedure has gotten better. The technology has advanced, but guess what? People want it and it's gotten cheaper. Another anomaly.
Containment issue, there's a perspective that the government can come in and improve efficiencies and do things more cost effectively. The reality is that we don't need a government pen manufacturer to make the people that make and manufacture and distribute this pen at the most cost-effective rate possible. We don't have to have government BIC to compete with BIC and all the other companies that do a great job of providing quality services at the lowest